Welcome to Roll Call, the many roles that we all play, a new series of conversations by Watsi about stories of care, courage, and connection. At Watsi, while we love to leverage technology, we believe healthcare is human. Join us in celebrating the many roles that we all play in bringing healthcare within reach for everyone. First, we'll go with you can let me know, who you are, where you're dialing in from, your work, and sort of how long you've been in this role.
Okay. So my name is Kanchana Thornton. My office is based in Mae Sot. I'm the founder and director of Burma Children Medical Fund. But now, however, we are registered now in Thailand under the name Health for All Foundations in Thailand. Talk to you from my office. My start will start soon in an hour.
Wow. Okay. Thank you for dedicating this morning time to us to chat. And tell me more about where you started also as a nurse, because I know that you had actually done education in Sydney, Australia. Is that right?
Yeah. I graduated from, it's called UTS, in Bachelor of Nursing. And I did my community health postgrad. I also work in emergency and department in Royal Prince Alfred Hospital and surgical department and Royal North Shore Hospital. So I traveling to Thailand on holiday and then end up in Mae Sot to, been invited to Mae Sot to have a look at the situation here and visiting the clinic here that help refugee and migrant population in Mae Sot. With my husband in the year 2000.
Wow.
Then the director and the founder of the hospital clinic, which serve migrant underserved community in Mae Sot, asked me if I would like to come back and help. So I say yes, and then I went back to Australia, applied for volunteer positions. So I came out to do Mae Sot as a volunteer, and resigned from my position at the public hospital in Australia, in Sydney. So that's how it started. So I came over to Mae Sot working in the children outpatient departments. And then I came to understand the gap, between the treatment gaps, right? So a lot of children that presenting to the clinic that the clinic cannot help and need to be referred on to the Thai hospital, secondary or tertiary hospital, and the clinic have not got any funding to help. So I start looking for funding or using our saving to help treating some of the children that the parents brought them across the border.
Wow.
Yeah, and that was in 2004.
That's incredible. I have so many questions for you because how did you answer that call? How did you say, yes, I want to, I've done my nursing education in one place, but I visited this other country that I really feel strongly about providing care at this level. And, this conversation we're having too talks about the many roles that we play. And I'd imagine, you as a nurse feeling very strongly, but you as a human being, you as a wife, you as someone who sees that there is a need here. How did you come to say, okay, this is what I need to do. I need to do this for, kind of my career. This is my calling.
It's the right to access to healthcare, because for example, nobody want to be born into a poor family or in a war zone, and the parents have tried so everything. They told us their story. they, because of the conflicts, the whole family have to come together for one person health care. So therefore, the love is already there, that they try to pursue treatment. And they try to do everything. They come, that they might save money for a month and walk for, a day or two to get to us. And we become the last hope for them, for some of these people. So then the thing is that I can say, okay, this is, I don't have funding, this is it, I cannot do anymore, but I can do a little bit more to show them that I can, like I will try to send them to the hospital, and if the doctors say, yes, we can treat, then I will try to get funding for it. But then if the doctors say no, then that will be it. Then there's nothing we can do. So, yeah, and if it's in Australia, everybody will get treatment, right? And no matter what, or in Canada, everybody will receive some form of treatment. And that's like, it's the future of the country, of the world as well. If the children receive the right care, then they can grow up and hopefully they become a good citizen and give back. And which many of our young patients say that I want, when I'm well, I want to help other people like you help me, for young kids. Yeah.
Yeah.
And some boy will say, like one boy said to me, the heart that my mom gave me is gone, it's dead. You just give me a new heart. You give me a new life. Yeah. So it just see all these people that try to live and try to fight for their family, and it's only fair for us to do a little bit more for them. And it's not a little bit now. Now it's not a little bit anymore.
It's not a little bit. Don't play down what you do.
Initially, I thought we just we just need to do a bit more to help out. Yeah. Now we register over 4,000 patients alone.
Wow.
That's just surgical cases in our program, not counting, like wheelchair, eye patient, emergency support, and education care that we provide. So
it's incredible.
Go on. Yeah.
You really were able though to put yourself in the position of needing that access and seeing the disparity between, care in Australia and care in Thailand. And it's really amazing to, for you to act on that. I think there's so much strength and courage in that. And it's incredibly inspiring. I will say, I also worked in the emergency department here. When you're telling your story, I'm like, gosh. And the reason I went into nursing was for my mom, because my mom always wanted me to be a nurse, but she took me to India when I was a child. And I just couldn't understand why the children there who looked just like me, who were the same age as I was, just didn't have the same access that I did. And, I came back with the perspective of, we have this gift and we're able to provide in a way that not everyone can. And when you, as you said, you give to someone who really needs it, and they take that gift and then they give it back and they say, thank you, I received this, I'm going to give back to my community now and grow and become a full person. And then from there, they'll have, their next generation. It's a beautiful thing to see in that way. And I'm sure kind of makes you feel like what you're doing is worth it, because as you said, 4,000 people is a lot of lives touched and a lot of communities touched. So I'm sure it goes beyond that.
I become to understand that, like, if we help the people in the country, we not just help individual citizens, we also help the medical system, the surgical team, the surgeons, the post-care nurse, because those those medical team have kind of they don't get to see that many patients because of healthcare system in Burma is user pay. So the medical team only see patient on an outpatient basis. But when it comes to surgery, if patient cannot afford to pay, they don't get to operate.
Wow.
And then post-care recovery,
Yep.
ICU care, they don't get to see any of the patient at all. So they lack of experience. By us for BCMF helping to pay for the surgery, it's a ripple effects, a positive ripple effects to the to the whole country, the whole healthcare system in the country. Yeah.
Absolutely. And are you able to tell me more about like the BCMF's work with Burmese refugees and how that works with folks coming to Thailand? If my understanding is they don't have access to care and they're seeking care, but they're sort of stuck because you're not really able to access services because you're considered an outsider. And would you be able to tell me a little more about how that works and what's going on there?
So at the moment in Mae Sot, there are sort of like kind of three type of refugee. There's a conflict refugee from the conflict area that could be registered in the camp, and then there's a economic refugee, right, that fleeing to Thai side to looking for job opportunity or work to send money home. And then there's an education one, that the children are living in a conflict area and the parents are sending them to Thai side to study for better future. As you at the moment, there's about in Burma itself, there's about 3.5 million internal displaced, over 3.5 million. About 1 million is in current state, which is across from Thai side, from Mae Sot. And you have registered officially by UNHCR about 90,000 refugees in the camp, in the 9 camps.
Wow.
But then you have an influx from current civil war. An influx, refugee move into the camp, is not registered with UNHCR, total about 150,000 in the 9 camps. 54,000 in Mae Sot, in the Tak district, which is close to Mae Sot area, right? So that's come under my catchment area.
Right.
As you know, USAID cut recently, right? And it's not just affecting the camp, it's affecting the community base that receive funding from NGO, that receive funding from USAID.
Yeah.
And that's including journalists to media team that receive funding from USAID. So go back to the refugee, direct so-called refugee. Then you get internal displaced population inside Burma along the Thai-Burma border as well, that also need access to medical treatment, to education, to food security, to shelter. That they're also under our catchment area. So refugee in the camps, at the moment we are directly dealing with 3 refugee camps that we help facilitate their treatment in Thailand, in Mae Sot or Chiang Mai or Bangkok. So the medics within the camp, the International Rescue Committee, IRC, is stop referring patients, non-emergency cases, elective cases outside camp. So they will only emergency refer life-threatening cases. The refugees already die from, like chronic disease and stuff in the camp. So medics will refer, the one that know us will refer it to us, and then for further investigation or treatment. So that's what we deal with. Besides beside the, all the migrant population in Mae Sot, internal displaced, cross-border refugees from cross-border that seek secondary or tertiary health care.
You are working so many hats. You have so many roles that you're playing. It's facilitator, your coordinator, your triage, you're working with logistics,
I'm
your
also a
fundraiser,
fundraiser.
you're working with the social determinants of health. That's a lot of different hats to manage. And how do you find yourself, like, how are you finding that you're able to do that? And then what do you do for you, like for yourself? I'd love to know, how do you keep your cup full? Because it's a lot of giving that you're doing.
Gardening.
Gardening?
Gardening. Yeah,
I
on the
mean, I've got
weekend. That's
plants.
what I say. Yeah, that's what I said to my friends. During the weekday, I treat human, like, and then weekday I treat my plants.
Hmm.
So, like,
I
yeah,
mean, you've got to talk to
yeah.
them. You've got to
I
make
talk to them,
sure
but yeah,
they're
I also
watered.
report them their water exactly.
What are you growing
Yeah,
in your garden?
I have a lot of orchids. Yeah,
Oh, so
yeah,
you're not just basic gardener. You are
no, no,
like expert
orchids.
level gardener, because that is
Yeah,
not easy.
yeah, no, but mainly wild orchids and so
That's
and
beautiful.
then I found the new ones and I actually was thinking about getting a vanilla orchid. My
Oh,
next
what's
one,
that?
yeah. It's
Okay.
vanilla orchid. It's a vanilla pot. It's an orchid.
Hmm.
It's the type of orchid that produce white flower.
That sounds beautiful.
So I just
I
find a different type of orchids and then go around the house. And,
like
yeah.
different species, and then you like to
Different
find them. And
species. Yeah, yeah, exactly.
how cool. It's really important to make sure that, you've got
Yeah.
something for you and to keep you balanced with things,
Mm,
because I'm
yeah,
sure there's moments where it feels really heavy and
yeah.
you're
And I like
balancing.
baking. I like making bread. I make my own bread.
Oh, are you a sourdough person,
Yeah,
or are
yeah.
you?
I try to do sourdough, no new bread. Yeah, yeah.
You are expert level at everything you do, and I am amazed by you.
Thank you.
It's unbelievable, just to hear kind
Yeah.
of like all of your amazing experiences. Um, Something that we also like to talk about is kind of like personal reflections that you've learned over time. And
Mm-hmm.
one thing I'd love to know is, like, what's something that you've learned the hard way? You've kind of really tried something and you're like, I really have to troubleshoot how I do this and how I approach this. It may not have worked out the first time, but then you tried again and it worked for you.
Um, Negotiations with the local authority is
Mm,
totally something new for me because I left Thailand when I was 14, right?
yeah.
And then I went to Australia. In the West, you have a lot of rights, but you don't have enough. You don't have freedom, right?
Mm. Hmm.
In Asia, you have a lot of freedom, but no rights.
Yeah.
That's what it, and depend how you utilize that. And that's what I
Yeah.
learned. How you approach your yes, you understand this is the rule. However, I'm doing this. It's not for myself. It's for the sick one.
Hmm.
And that's how I able to um, move patients to receive treatment, the care that they need, that they have the right to receive in like outside Mae Sot, in Chiang Mai or in Bangkok.
Yeah.
So and then I need to inform the authority. I need to build my network to get them to understand, like, and then show them the positive outcome with their corporations. This is what happened. Yeah.
Right. Yeah, and you're advocating on
So
so many
yeah.
levels. And as a woman,
Hmm.
I'm sure that's not easy
Yeah.
to do as well.
No. Hmm.
Hmm.
It was quite hard. It was really hard. For 2 years, I escort patient myself to Chiang Mai, like 6 hour journey,
Oh my
and then
God.
uh, navigate patient around the hospital, and then traveling back with the patients.
My goodness.
Set up the system, make sure that the hospital at different level understand where our patient come from, the needs that they yeah
Yeah, and
that,
telling
that
their
they
story.
should have, tell their stories, and ask them for support, and yeah, so
Wow.
and make sure that the driver is understand our patients, because I put their
Yeah.
life in this driver hand. They put their life in my hands, and I put their
Hmm.
life in the driver hands. So I need to be there to make sure that the driver is be careful, and is also will take care of them, of all these patients, and put
Yeah.
system in place. And because there's a lot of checkpoint, our method, that the
Right.
patients need to feel safe.
Hmm. It's not just
Yeah,
simple A to B. There's a lot of
no,
different in
exactly.
between
And
points. Yeah.
yeah, and we have patients come from refugee camp, come from the jungle area of Burma, that doesn't know about car, the etiquette of being in the car, not throwing rubbish out the window.
Yeah, there's so many layers to it. There's cultural elements and there's so many risks
Totally.
also that you're like
Yeah.
calculating every
Yeah.
moment to make sure
Yeah.
that it's a
You have
safe
to understand
travel.
that. Yeah. And that's
Yeah.
why I need to go with them and then observe and analyze, so then I can explain to my staff that will take over the project and look after the patients. And like, I mean, it's from the beginning we have to have a roll call. Now we still do COVID tests before they get in. You have to educate all the patients and the caregiver about being in the car. And yeah,
Hmm.
a
Wow.
lot to think about. Yeah.
A lot
And
to think about.
they teach me a lot as well. Yeah.
Yeah.
About
Uh,
different type of human being, different cultures, different belief systems. And yeah.
It's a really human, level experience, I'm sure. Sometimes
Yeah.
I feel like, you can have any position in the world. You can be a CEO, but you come to the hospital, you're in a gown and you're a human being,
Yeah.
and
Yeah.
that interaction is very unique.
Mhm. Yeah.
And so you're kind of like able to take away, all of that and really just focus on the human aspect and making sure that person gets their care from
Yeah.
A to
Yeah.
B, and
Yeah.
you're advocating for that as well, which is unbelievably amazing.
Thanks.
Can you
Well,
tell
I
me a
have to
little?
thank my team. I actually have to thank my team for all that.
Yeah.
So,
Well, it's a perfect segue to, I was just going to say, what does
uh-huh.
what is it like to be a part of the Watsi community as well, and how has that sort of impacted your care and your work?
Like, we feel kind of nice to have Watsi back us up. We
Mm,
always know that your Watsi is always there for us. And then if we have any problem, we can communicate with the team. And so now I have my team that comfortable. I don't have to do all the negotiations with partners. So my team
mm,
can manage that, which is quite nice. And they, because of flexibility of WASI, that it make it easier for my team, because most of my team are ethnic group. Like we have Karen, Burmese, Kachin in the team, for ethnic group from Burma.
mm-hmm.
So, and it's important to, for the outsider to understand, and communications that make it
Yeah.
easier for them to manage by themselves. Yeah. So we always are like at the end of the month, have we still got any money left in Watsi?
Yeah, exactly.
So we have
Hmm.
we have another emergency case coming in. can we submit? You know?
Yeah.
Yeah.
And I'm sure like it's
Yeah.
nice having
So
that support standing behind you. So
for
that's
sure,
excellent.
to know that we have that support, it is very important for our kind of work.
If you had advice for, a future healthcare provider or a future nurse who is really, unsure if they should take the leap, and you are such a great, wonderful example of somebody who's taken the leap to care for others in a boundless way. So, any advice, big or small, would love to hear it.
Um, for me is thinking outside the box. In our profession, healthcare, yes, this is what our job, but like if we can do just a little bit, is might create a big impact to other.
Yeah.
That's so, yeah.
That's
Yeah,
beautiful.
yeah.
Thank you. I want to send you a hug. I'm sending you a hug. I wish I could give you
Thank
a big hug
you.
right now.
Thank you.
Because
Yeah.
I personally am so grateful to have this conversation with you. I think that you're a very inspiring individual and you make such a massive impact to communities around you. And I'm sure everything you touch, including your orchids and your sourdough bread, I'm sure they're amazing.
Thank
So
you.
once again, thank you so much. Appreciate all of you things you do and just spending time with me today.